So how do you refuse to treat a patient who has had too much work done already? So this is a very delicate process, but one that you will absolutely face. And it's very important that you learn the skill in terms of how to do it. Now, the first thing, as with all the education that I give it, you need to be founding your treatment design around your patient's needs. So once you establish what they're looking for underneath their treatment request, because a treatment request is often, I want my cheeks done, I want my lips done, or whatever. And you may look at them and think you've already had way too much. You need to then dig deeper about what it is they're hoping to feel after that process. So I want to feel more beautiful. I want to feel younger or fresher, or maybe it's just simply a sense of newness. Now, once you've got to the bottom of that, you can then establish whether that is a sustainable goal and likely to make them happy, or if they're actually asking for a treatment that's actually not going to deliver what they actually want. And this is kind of what we're saying with overtreated patients, which is we know they want to look fresher or younger or more beautiful, because that's probably what most people want. But we also know that giving them more treatment is going to make them look more done instead of more beautiful. And most people who, if you speak them through that process in a very clear and on their side with zero contempt, it's very important that they feel your warmth, that you're trying to actually help them rather than judge them, because it is a delicate thing, because they've actually done these procedures to themselves. They will usually take your advice. Now, that's not always the case, and it's certainly the more experienced I've got, the more patients will take my advice. I know when I first started, I was very much, I didn't have the confidence to convey to people in the way I do now exactly what will help them and why I wouldn't treat them further. So it is something that you will develop over time. But I would essentially say you've got to ground it in what their goals are. And then you've got to do some education. Now, teaching is a big part of what a good aesthetic clinician will do with their patients. You need to explain to them how this could have happened. So you've told me that you haven't had treatment in a while, but I can tell that there's some filler left. Now, we know from my interviews with Dr. Master that ultrasound has proven that filler lasts years in people's faces. It just doesn't always stay exactly where it is. It's kind of diffusion. It's kind of like migration, but migration always makes it sound a bit to me like it's one lump that's moved somewhere else. It's much more subtle than that. It's a diffusion, which causes a general puffiness in some people's faces. Not in everyone, but it does in some people. So you need to get them on board with that concept that although you feel like you're only having treatment every so often, I think you've actually got treatment that's been building up over the years. And occasionally you'll meet someone. I remember once meeting someone who'd had treatment over 20 years and had a huge amount of product, and it was actually fairly frightening for me to see, because such a huge amount had been put in, and she was completely oblivious of it. So we had to have a very long discussion around how product can last different lengths of time and how it can build up and how your own mind gets used to it. So it's a bit like, I often say this to patients, it's a bit like watching your children grow. I don't notice my children growing, but my dad hasn't seen them for 2 months. He always says, wow, they've changed so much. They've learned all these new words. It's a bit like that with filler treatment over time. It can creep up on you. So if you can get them to sign up to the concept that it can last much longer than people think, that it can diffuse a little bit, and that your brain is not very good at telling when that's happened, then you're a long way to the journey of saying, we probably shouldn't just keep putting more in to try and solve the problem. There is that old saying that when your only tool's a hammer, all your problems look like nails. It's a bit like that with dermal filler. If you keep trying to correct every problem with filler and you're never taking any out, eventually your patients will look overdone. So we need to make sure that they're educated, that you're educated, and then you need to, once you're on that stage, give them some different options. So option one would be you could wait. Now, there are some people who, with that waiting game, will be years before you can really tell a difference. And then I actually think there's a growing cohort of people, the longer this sector goes on, who do need occasional reversals. Maybe every 2 or 3 years, you basically reverse procedures and start again from fresh. Now, not everyone will be up for that, because obviously you are going backwards. You're going to lose some of the benefit, as well as getting rid of the overtreatment. But I think that's the only way that you can keep people looking natural, is to occasionally start again and then do a full refresh. And that will actually keep them looking fresh and natural. So that's the kind of process I would go on. But you are correct, it's difficult. As always, with everything I say, the key is you build it around their needs and you lead them through with education that gives them the same impression that you've got, because you've led them from their position to your position in this carefully communicated process that's built around their best interests. That's what all good clinicians do. It's always built around your patient's best interests. Hope that helps.